Hello and welcome back. I'm Deena Jiles, your host, and you are here for a night of celebration. We're here to raise money for Tropical Clinics, a clinic started by Dr. Margaret Kalibwa, located in Kenya. The clinic itself is located in Kakamega, Kenya, and there is a serious healthcare crisis that is going on right now in Africa, in so many different parts of the continent, and specifically Kenya. Right now, there's a huge HIV and AIDS epidemic that is taking place, and one of the areas of need that they're having is just in obtaining healthcare workers. One facility actually has one nurse that works throughout the night taking care of 70 AIDS patients, most of whom are dying. So one worker taking care of 70 patients who's there throughout the night. Sometimes 5 to 6 people die during their shifts, but there's just one worker to take care of all 70 patients. It puts a tremendous strain not only on the patient but also the healthcare worker. As a result of that, lending or adding to the crisis, a lot of the healthcare workers are leaving the country for places where the conditions aren't as rough for them. So there's a tremendous need to give. There are no sheets on many of the beds. There are no doctors, no nurses to care for or feed patients at times. If they can't afford to hire these people, then they leave the country. Often people wonder, can only one person make a difference? Yeah, one person can make a difference by making a donation today to help with Tropical Clinics. In the next 24 hours, over 5,000 Kenyans will die from AIDS. In 24 hours, 5,000 people will lose their lives because they don't have proper medical care, because they don't have the proper medical supplies, because they don't have the proper medication. 5,000 people in 24 hours. Today, over 1,400 Kenyan mothers will pass on HIV to their newborn babies. 1,400 Kenyan mothers will pass on AIDS to their newborn babies. New mothers are forced to sit in the waiting areas after giving birth, immediately after giving birth, with sick patients, because there's no place for them to go. The facilities are not able to maintain the numbers of patients that they have. So because there's such a high need for beds, newborn babies are placed into waiting rooms with sick patients, which their immune systems are very low. Most of the children aren't able to, their parents aren't even able to afford vaccines for them. So there's a tremendous need to give today. TB and AIDS patients are crowded into the wards. Nurses leave the country because they prefer to work abroad rather than staying in those conditions, as I said before. There's a chronic shortage of doctors and nurses. People are sharing beds. There are no sheets on the beds. The needed medical supplies are blood pressure monitors, something that we take for granted, something that we living here in the States find commonplace when we go to our doctor's office. A blood pressure monitor is something that is needed there. CT scans, HIV testing kits, with so many of the population being infected by AIDS, they're in need of HIV testing kits. They don't even have enough kits to find out who's infected. There's a tremendous need. Microscopes, ultrasound equipment, mammogram machines, HPV and Pap smear screening kits. Again, things that we take for granted, things that we simply expect to be there when we stop into our doctor's office. Could you imagine going to see your doctor and just for your annual physical, and they don't even have a microscope? They don't even have a stethoscope. They don't even have a blood pressure monitor to tell you what your current health is that day. This is something that the people in the country of Kenya are in dire need of right now. Laundry equipment. to wash the beds, to wash the sheets after after one of the patients who's dying in one of the wards has passed. They don't even have enough equipment to do the laundry. Kitchen supplies, something as simple as kitchen supplies. Ambulances to transport patients from one city to the other. Right now, a majority of the hospitals are located in the larger cities in Kenya. So there are a number of patients, a multitude of patients who live in the rural areas, and they have no sort of transportation to get them to their doctor's appointments. A lot of them ride bicycles. Women, 1 in 19 women die during childbirth. 1 in 19 women die during childbirth. The number is astounding that many women are passing. Some of that is due because they don't have transportation to get them from their home to a medical facility. Can you imagine a pregnant woman in labor riding on the back of a bicycle to get to the hospital, riding 15, 20 miles over rough terrain to get to a hospital? Many of these women hemorrhage and die before they ever make it to the hospital. And not to mention what happens to their babies. They are in need of vans and cars, again, to simply help transport sick patients. Computers and computer equipment, another thing that we take for granted. Another thing that we can help to do to help those people that are in need, to help give some of the things that we have to help out. Public facilities in the Kakamega region suffer from serious shortages of medical supplies and equipment. 40% of children under the age of 5 are malnourished. 40% of children don't make it to live to see 5 years old due to malnutrition, simply because they don't have the proper foods to help them grow, to help sustain growth. They lose their lives. 40% of children die before reaching the age of 5. There's a tremendous need to give. And that's where you come in. That's where you come in to help Dr. Kalibwa, to help all of her supporters give to those people in need. It's very simple. All you need to do is log on to our live stream page and hit the PayPal account and donate whatever you can. $5, $10, $15, $20. Some of us spend more than $5 on a cup of coffee every day. $5 can help provide vaccines to children in need, in Kakamega. So whatever you can give today, please, please, we need you. Without you, this can't go on. So we just ask that you give today. Outpatient and inpatient wards in Kakamega region are overcrowded with patients. They don't have enough room. People are lying in the hallways, on mats, on blankets, sometimes just on the bare floor, because the hospital simply can't sustain the number of patients that they have that are coming into them. And again, many of them infected with the HIV virus and some of them with full-blown AIDS. There are 100 times more pregnancy-related deaths in Kenya than in the U.S. Infant mortality is 10 times higher in Kenya than in the United States. An entire generation is being wiped out by curable diseases, by preventable diseases. So again, we're just asking today that you log on, that you stay with us throughout the program, and that you stay with us because maybe there's someone out there that you can touch with your generosity and bring them to Tropical Clinics or bring them to the website so that they can help as well. So but we do ask that you stay in and stay tuned for the entire event because we have a lot of amazing things coming up for you here shortly.